So patients, and this comes out of research as well as kind of what I've found in working with patients, but patients really love how convenient and accessible telehealth is. Some patients are even more satisfied with telehealth because it meets them where they are. If you think about PTs themselves, I always say it would take such a big issue for me to have to leave work and go to my own physical therapy and, take time off of work. And so it's so nice because people, have to give up half an hour of their day instead of 2 or potentially 3 hours, depending on where you live. And if patients have had a positive experience before or a negative experience before, it's obviously going to color what they bring into their next physical therapy, session or appointment.
Hali's on the show. Hali Jones, a PT with a passion for bringing innovative health tech into the hands of clinicians and patients. Is that a good summary? If I had a 1-sentence summary of you?
I think so. I think we're a profession that is a little slow to adopt new things.
I'm gonna say cautious, but
we are cautious.
But we are slow. But we're of cautious, a good reason.
Rightfully so. What do you think the reason is? Because I've thought about this because I've been doing this for a while.
Great question. Look at you flipping the interview. We're 32 seconds in. Why are we overly cautious? Because we deal with people and we don't want to just zigzag the wheel left and right. We don't want to overcorrect, maybe.
Because we care.
Yeah, I think that's it. We want to make sure it's right,
I think you're right, but I think we've swung kind of so far the opposite way where we're very cautious because we've gotten our nose burned a little bit.
Yeah, I say to people, a deer's crossing the road. There's 3 positions the deer can be in: the side of the road it's on, the side of the road it wants to be, and in the middle. And then we start to go cross the road and we get nervous. So what do? Deer in headlights, we freeze. But that feels safe. Freezing feels safe, except you're in the middle of the road. That's actually the worst thing you could do. So I tell people all the time, listen, you need to make a decision. Indecision is a decision. You've decided not to act. You decided to stand in the middle of the road. That's bad too. I know it feels safe though. So maybe there's a little psychology as it feels safe not to jump in. But I'm like, I don't know, man, it's 2025. It might be worse to not move.
Yeah, it feels safe not to jump in. And we've, even from when I graduated not that long ago in 2017 compared to now, I feel like we as a profession have learned that we were doing a lot of things that maybe we shouldn't have been doing. And we were drawing the wrong conclusions, even if the things we were doing worked.
Yeah.
And we kind of got it handed to us, from our own profession, from other professionals. High quality PT research too is like kind of hard to do.
Yeah.
And so, I don't know that. I guess I'm cautious because I feel like I was doing things when I first graduated and was first practicing that I look back on now where I was like, I was so wrong. And how can I avoid that feeling of being so wrong and wanting to reach back out to patients that I treated 7 years ago and say, oh, I'm so sorry. By the way, I told you something that was wrong. And I don't want you to hold on to that narrative forever.
So let's say this. It comes from a good place, but we know we need to do better. And we need to move forward. We need to figure out a great balance of those 2 things, moving forward and knowing better, which is a good marriage of research, which is number 1. So the goal is 6 things you didn't know about telehealth physical therapy, virtual physical therapy. Is there a term we like better than others or no?
I would probably alternate between many. Telehealth, virtual PT, digital PT, there's so many different ways to go about delivering care on, a virtual platform. I think that's why it has so many names.
And then the reason you're here and you're talking about this outside of a passion, this is what you do. You're part of the team at ViFive, which we'll get into in a later episode. I want to do a deeper dive of what ViFive is. That's software. Make sure I get this right. Software as a service health tech company platform with the goal of revolutionizing how we approach this telehealth, virtual health, and this patient experience. So that's why you're here is like, not only are you super interested in this, you do this every day from the aspect of a physical therapist and somebody who works with this organization. You sort of get to balance and live in this world. So let's get into it. 6 things maybe you didn't listening know about telehealth physical therapy. Number 1, I want to start with the basics. Does telehealth PT really work? I have friends who are super, but maybe that's
I know.
Dave.
I heard Dave the other day and I was like, oh, I can't not comment on this.
So let's go to the research. What it does. My question to you for number one, does it really work? Not just from your gut, because you work there.
Yep.
What's the research say?
The research says it does work.
Okay.
And I think there's not as much research out there as we as PTs want to be like, yes, I can hang my hat on this. But there's a lot of research out there, looking at post-op care, looking at knee pain, looking at hip pain, looking at balance and fall risk, and just, purely like strengthening, that shows it is effective. There's a systematic review all the way back in 2019, which is kind of old now, right? That's 5 years old. When I think about how much development there's been in just the telehealth realm in the last 5 years, but they looked at 48 different trials. And they found that telehealth was no different for pain outcomes, physical function, or quality of life in the long term. And that's high quality evidence. How often do you look at a CPG written by the APTA and find their recommendations and see how many have high quality evidence behind them?
Right.
Very few, even for our clinical practice guidelines. So the research is there to support it. And then short term, we've got moderate quality evidence for it. So research is there, but again, I think what I want to see more of is more condition specific, ways that telehealth specifically is really effective for different kinds of conditions. And we're going to see more of it. As I do literature reviews, there's so many trials that are in progress right now or that were done in the last year or two and just aren't published yet. So I think of the next year, 2 years, 3 years, we're going to be seeing so many more high quality studies that hopefully, continue to support the delivery of care, but also start to poke holes and get really specific for the populations and the people that it's not going to work well for.
Because that's a question. Like, does it work? Yeah. But like, where?
Yeah.
Does it work everywhere?
And for who?
Right. And for who and when and what is it best at? All right. So that's.
And anytime you hear like this works all the time, I think as a PC, you get a red flag. Your spidey sense goes up because you're like, bullshit. Like
run away.
There is no panacea. There is nothing that works for everyone 100% of the time.
Correct.
So I'm really looking forward to, just seeing more and more research over the next couple of years. We have a study that's coming out hopefully this year that we treated chronic knee pain with Stanford. And we did a 12-week virtual care, met once a week with patients, did a ton of education, prescribed them exercises, made sure that we were modifying exercises as people needed. And we have great outcomes. So I'm super excited for our study to come out, but I'm really excited to see more and more because I think that'll help move the conversation along.
So you're moving towards the next question, number 2 on the list of 6 things you didn't know about telehealth. You mentioned patients love telehealth, or the ones that interacted with you, or some patients. Do all patients love it? Of course not. There's no way, right? Some people just like different things, and that's what makes the people. But what drives their satisfaction? Let's zoom in. So the people that do love it, what drives their satisfaction? And are there any misconceptions clinicians have about the patient experience?
So patients, and this comes out of research as well as kind of what I've found in working with patients, but patients really love how convenient and accessible telehealth is. Some patients are even more satisfied with telehealth because it meets them where they are. If you think about PTs themselves, I always say it would take such a big issue for me to have to leave work and go to my own physical therapy and, take time off of work. And so it's so nice because people, have to give up half an hour of their day instead of 2 or potentially 3 hours, depending on where you live. And if patients have had a positive experience before or a negative experience before, it's obviously going to color what they bring into their next physical therapy, session or appointment. But that's the same for in person. I've had patients come in and go like, this doesn't work. My wife made me come. And you know what? All it takes is like, hey, I'm really going to be curious and try and figure this out and move the needle a little bit for you. And then opinions change. But I think convenience is just a huge factor that you can't get away from. And then geographical location too. If someone has to drive an hour, if someone has to drive through traffic, if someone has, childcare duties at home, if they're caregiving for someone and it's not easy to find coverage and leave, I just think we are not talking about the patient benefits enough. And they're our customers, right? We should care about what they care about and what's hard for them. And I just don't ever hear that really come up in conversations with other PTs when we're talking about telehealth and why or why not, you might engage with it.
Physical therapists, if you're not up on blood flow restriction training, you're missing out. BFR, it's the future of rehab. Owens Recovery Science has the certification for learning BFR from the ground up. You'll get hands-on with the best tech, expert insights, and tools to deliver real results for your patients. Stop waiting. Check out owensrecoveryscience.com. That is owensrecoveryscience.com and get certified in BFR today. Physical therapists, if you're ready to stop playing small and actually master your specialty, Brooks Institute of Higher Learning is where it's at. Imagine one-on-one mentoring, hands-on labs, top-tier facility, all while earning a full salary and benefits at Brooks Rehabilitation. We're talking 8 cutting-edge residencies, specialized fellowships, and a 93% board pass rate for graduates. Get trained by the best with the best. Check out brooksihl.org. That's brooksihl.org and start leveling up your career today. All right, so that's number 2. Number 3 on the list. You think therapists are getting in their own way. What does that mean? How can PTs get out of their what is in their own way, and how do we get out of our own way? What's that mean?
Again, I've talked to a lot of PTs the last year and a half. A lot of PTs about telehealth. I've talked to a lot of practice owners about telehealth. And there's a general sense that people aren't excited about it. Yeah, I did a little bit of that during the pandemic. We pivoted. We moved away from it. And when I ask why, it's not because patients weren't interested in it,
Right.
Which is interesting because you just assume that the market is going to lead your business decisions. But typically it's because the therapists weren't enjoying it. Therapists didn't like it. They didn't feel like, it was engaging for them. They were dreading the time they might have to, log on and do a telehealth visit. And I think some of that came out of the pandemic. I was a clinic director during the pandemic. We had to pivot to telehealth in one day. And it was pretty awful. I don't know if you were in the clinic, Jimmy, at this point, or if you've done much, but being forced into, delivering care in a whole new way with almost no framework for how to do that well and be confident about it as a physical therapist caused so much anxiety in me. And it's really hard if you're a PT and you don't go into those appointments confident because your patient picks up on that right away, right? If you're like, I don't know what I'm doing. I literally heard therapists tell this to patients, I don't know what I'm doing. This is all new because they're frantic. And I'm like, well, you just lost your patient. And then you lose your engagement, you lose your outcome. So we didn't like being forced into it, but part of that too was because we didn't have tools, right? We were using Zoom.
All right.
So
we're winging it.
People were in their pajamas on their couch. There was no expectation set because no one, it wasn't something that we had time to prepare people for and say, hey, this is how we're going to structure these sessions. This is what we expect from you. This is what we expect to do. It was just kind of this confusing time. So I think that was a lot of physical therapists' entry point into telehealth, and it was not a good experience. And it wasn't a good experience for me either.
Yeah.
It
was also stressful. Not only were you changing how you were doing, you were sort of changing what, right? Your entire workflow. The fact that your body language, you're only seeing half of a human, or if you're asking someone to move, getting someone to move in front of a camera is weird and awkward because everybody's setup is different. So this was a monumental change. But so that is another thing too.
Logistically, it was hard. It was uncomfortable. We had these tablets that didn't have the hinge on them. So trying to position and move so I could show people, I hung up on so many patients. If my tablet closed, guess what? The whole thing closed. And I would have to re-enter. It was just, it was a nightmare. But again, I think some of that is because we didn't have good tools, we didn't have good workflows, and we didn't have appropriate patient and therapist expectations about how you can structure those sessions and be really successful.
Good radio segue into number 4 on your list. You highlighted that for a telehealth program to be successful, it needs two things. And we love when we can narrow it down to two or three things, right? Three little pigs, three musketeers, right? So two things,
And I think,
a triage system and PTs who excel in communication. Why are those the two things you got to narrow it down to?
Well, I think that's the entry point, right? Barriers to entry, if you don't set up these two things, you're almost certain to fail.
Sure.
And then there's lots of things that you can prove on after. But if you don't have some type of triage system, it's going to be really stressful for your therapists, frustrating for your patients. And then again, it's easy to kind of conclude that like telehealth doesn't work.
So what's a triage system look like, and why is that important? Like, what is it like?
So I mean, that's where I go. Like, it's almost like there's so many ways you can do this that I think it's hard to adapt.
Right.
But a triage system could simply be, a PT calling back patients that, call about getting scheduled for physical therapy and take, 5 or 10 minutes on the call to identify if they've got any major red flags, if they've got, potentially a ton of like neurological involvement, looking for, or if you're in 10 out of 10 pain, looking for those immediate signalers that would either say you'll do better with an in-person evaluation because there are things that I need to do hands-on to be confident about what's going on with this patient, or just flag a patient that maybe is not going to respond well to a telehealth approach, which means you can't do manual therapy interventions. You can't do dry needling. You can't do that. So if someone's calling about an acute disc injury and they're in 10 out of 10 pain and their back is spasming, most likely I'm going to say that patient is probably going to be better suited to an in-person evaluation at least, because, hey, there are some things that we can do to get your pain down in the short term and then allow you to move more. So I think triaging either synchronously or asynchronously. I mean, this is something that you can do over Google Forms.
Sure.
You can set up a HIPAA compliant Google form and have your patients fill that out. And same thing, it can be body region specific, back, knee, hip, ankle. You have your red flag questions there. You have a question about whether a patient is open to telehealth. That's huge too. And then filter it that way. But you do need to think about and set up some kind of structure to make sure that you can triage patients and not get blatantly, obviously not appropriate patients into your system right away.
So now you got the patient half of the equation. The second thing you said on the list was PTs who excel in communication. This is not better, not worse, different. And because it's a different tool and a different delivery, you need people who are at least open to it. Number one, open to it. And then, it'd be better if you're better at it, right? It sounds simple.
It does sound simple, but the PTs that are like, I hate this. Like, I'm probably not going to lead with those PTs, right? They probably need more structure. They need, a narrow scope of people that they're going to build up confidence with to deliver care this way. But you also maybe, and I don't know, I'd be interested to talk to new grads to see what kind of education they're getting around telehealth, but you also might not want to throw a new grad in that situation. Because it's one-on-one. There's not a therapist that's like right next to you that you can say, hey, I have a question about, this, and I need a little bit of help, or, it's a little bit more isolating in the fact that like, if you're in a session, it's you and the patient and you don't have as many resources as you might have if you were in person. But it's so much about communication, right? When you're doing telehealth, you have to be able to verbally instruct a patient what you want out of them in as few words as possible. And then you have to be able to make sure you can articulate your clinical narrative in a way that patients are going to understand and buy in from that first session, just like you would in the clinic. But arguably, it might be a little easier in the clinic because you can throw them in front of a mirror and say, do you see what I'm seeing? So you have to be a little bit more comfortable and I think really excel in listening to patients and then communicating with them.
So, and again, one thing I picked up on from what you were saying is, hey, just because you might not like it or be good at it at first, these are skills. And what I know about skills are you can teach them and get better at them. So, hey, you might take someone who is anti, or I'll never do that, or I'll always do it this way. And you can say, well, if I can give you a framework and make it simpler to understand, or teach you how to do it better, there's an opportunity for that. And those are good things to pay attention to. The second part of what you said was has to do with the patient. And number 5 on the list has to do with compliance. So when compliance comes up, that's important. What are they doing after this telehealth session? You think ViFive addresses patient compliance in a really unique way. Talk about that, of why patient compliance is needed, right? Especially in telehealth. And then how are you solving it at ViFive?
Yeah, I mean, I think no matter what a patient needs, if they need real strengthening, if they need movement snacks, if they just need graded exposure, if they need high volume or low volume, we're really specific, I think, as PTs in thinking about what's going to be hopefully the best approach to treating someone and then giving them a really specific plan.
Yeah, make it clear.
And what's so painful is that a lot of times you just don't know if that plan's being followed, which makes it really hard for you as the therapist to troubleshoot. When they come back in, they say, hey, this isn't working. I'm not getting better. I'm pissed or I'm sad. So ViFive has a web app. We have a platform online that we use to give out our home exercise programs. So it works just like most software does. Many people just get a link with their home program in it, and this is the same. We email them a link to their home program. They see the list. They can log on and see what their exercises are, but then they do it in front of a webcam.
Right.
If they have Wi-Fi and webcam enabled device, they do their program, and we get objective compliance data. So I can see when I meet with a patient in a week or 2 weeks or 3 weeks, I can see exactly what they did, what they skipped, and how long it took them to do it.
Right.
So if you have a patient that says, I need a program that's less than 10 minutes or I'm not going to do it, I can make sure that my program is less than 10 minutes and it took them less than 10 minutes to do. If I have someone that I absolutely want taking a rest day between, days that they do their program, I can make sure that's what they did, that they followed that instruction. And if they didn't, I go oh, this is a communication issue. I have to make sure I'm either really clear or understand why the patient didn't follow, what I asked them to do. So it's so helpful for me. It makes my life so much easier when I don't have to do the mental gymnastics of, did they do what I said? Are they lying to me? Or are they misremembering what they did?
Sure.
Did they do something I didn't ask them to do because they just didn't understand what I wanted them to do? And our software actually allows us to replay people's home programs. So they log on, they do it. I can see a wireframe of people going through their program. I can literally go back and watch what they did, which I don't have to do often, but I can when a patient says, can you look at that one exercise that you gave me? I'm not sure if I was doing it right. I can go and check. And that feels really good for a patient to know, I'm in their back pocket.
Here's a question for you. Do you want to boost your clinic revenue by $290 per patient per quarter? Of course you do. That's rhetorical. Physiotech's remote therapeutic monitoring can help you do that, enhance patient outcomes, ease provider workload, and turbocharge your earnings. Kickstart with RTM at physiotech.ca. That's physiotech.ca. And the thing you interact with the most at your clinic, if you're a therapist, like it or not, is your EMR. MW Therapy's all-in-one outpatient PT EMR gives you seamless integration of patient portals, marketing automations, and billing, all at one unbelievable value. Switching over is a breeze too. Kick the tires, take a test drive at mwtherapy.com. And where is your PT career going? It's not rhetorical, that's literal. Embark on extraordinary patient care adventures with Jackson Therapy Partners. Visit them at jacksontherapy.com. This is perfect for physical therapists eager to make their mark, to do what you want to do, where you want to do it. Discover where your career can take you at jacksontherapy.com.
Interesting place. Portable and stays with them. Number 6 on your list has to do with sort of an untapped market. And you also say it's not just A or B. It's not yes or no to virtual physical therapy, telehealth physical therapy, whatever we're actually slapping a label on it. You think that geriatrics, specifically older adults, is a huge untapped market for hybrid and virtual care. Why is that the case? And how can physical therapists better serve that population?
Yeah. I wanted to shout out geriatrics because I think we still have an idea that like older people aren't very tech savvy. Um, and I don't think that's actually the case anymore.
No
When I was
way.
in the clinic, I had my, 80-year-old patient showing me TikToks that they liked. And I'm not on TikTok. Like I think arguably, they've been exposed to tech long enough, their smartphones long enough that they're so much more capable than we give them credit for.
Yeah.
And we're doing a disservice to them by just automatically assuming telehealth is not going to work for a certain generation of people.
Yeah.
And they're arguably the market that needs this the most. If I think about safety issues, if I think about people that don't drive or aren't comfortable driving, if I think about people that are post-op and in a ton of pain and don't want to leave their house, these are the people that are getting the most amount of, orthopedic surgery. And we probably are giving the least flexibility in terms of like how we're delivering care to them.
Yeah.
And again, I have an 86-year-old patient that uses, that does virtual physical therapy with me, that uses our web app, that absolutely loves it and took less coaching than a lot of my like 40-year-old patients. So I just want to really, give a shout out to the fact that geriatric patients are absolutely able to engage with technology. It's not just like assume that they can't handle this.
Don't count them out. All right. So that's 6 things you maybe didn't know about telehealth, virtual physical therapy. I've got a bonus one for you, Holly.
Okay.
You believe this is the perfect time. So the question would be like, okay, well, why now? I'll wait. Because we started this conversation off by saying maybe we don't lean in as a profession fast enough, right? You and I are probably the same. Go faster, go faster. I'm a go faster, fail fast kind of guy. But you think now is actually the perfect time for clinics to carve out their space in telehealth. Why? Why is now such a critical moment? Why should someone who's listening, who maybe owns a clinic or is a solopreneur or part of a large organization, why can they, what would you tell them to arm them with to go to a decision maker and say, we should do this now. Now is a good time.
Well, digital health is coming. It's not going to stop coming. We have statements by the APTA and the American Medical Association that are prioritizing digital health interventions. As an organization, they're saying that we need to innovate. We need more of this.
Yeah.
So we have our professional organizations saying we need this. We need everyone to get involved, and we are going to prioritize this. So when we have that many people that are on board at a high level, I think it needs to kind of trickle down. That message needs to trickle down to us because there are lots of large health tech organizations that are all over this. When you think about CVS, when you think about Walgreens, when you think about, pharmacy and health plans and payers, they're all having these conversations and they're very serious about how we get involved in digital health, how we cut costs, how we provide better care and better outcomes. And digital health really enables all of those things. So at the highest level, these conversations are happening. And, brick and mortar clinics and, especially brick and mortar clinics, hospital systems, if you're in a PT organization with hospital systems, you're probably going to naturally kind of get on board with this a little bit more because they're going to have initiatives for it. But, mom and pop clinics, even like medium-sized PT clinics, if you don't carve out market space now, sooner rather than later, introduce your regional demographics to the fact that this works and we have a solution for you, other organizations are going to come in and start taking some of your market share. Again, this is so convenient that people just need to realize that like the wave is coming. Don't miss the ship.
Yeah. What was the Japanese? Is a Japanese proverb where it's like the best time to plant a tree is 20 years ago. The second best time to plant a tree
is right now.
This is right now. I mean, how many people was I talking to 5 or 6 years ago, not that long ago, and saying, I know you're a large organization, you have clout, but unless you're creating content, communications, unless you're creating something, and it doesn't have to be just a podcast or just video, but it needs to be something. Bonus points if you can create multimedia, which is what they call it, multimedia. We're past that point now. Now people are saying, oh my gosh, we're so far behind the ball. It's like, yeah, you should have planted that tree 20 years ago, but I'm glad you're in front of me today as we can start doing that. Where can people contact you specifically? If someone's still nodding 20 minutes into this conversation, like, okay, got it. Give me a little more. Where can they find out about ViFive? How do they connect with you specifically?
So you can just Google ViFive. If they want to find our website, they can find me on LinkedIn. Hali Jones. My name is spelled wrong. It's Hali.
It's not spelled wrong. It's how you spell it. It's just maybe people like me look at it and maybe say it. It's Holly, but it's Hali. Make sure they get that.
That's right. It's Hali. Or you can email me, Hali at ViFive, ViFive.ai. And I'm always super happy to chat. I do a lot of demos. I do in-services for clinics. So yeah, reach out. Love talking about this and seeing if I can help people kind of move the needle a little bit in the organization.
Last thing we do on our show is called the parting shot. Last chance for a mic drop moment, soapbox statement. What would you want to leave the audience as we wrap up? What's your parting shot?
If you have something that you as a clinic or a clinician feel really passionate about and treat really well, that's where your entry point is into virtual care. Take the thing that you're most confident about doing and start there, because it'll be the easiest thing for you to transition well.
Yeah.
And then let everything else kind of come after that.
Hali Jones, ViFive. Thanks for educating us on virtual and telehealth physical therapy.
Thanks.